Having an organization like the Colon Cancer Alliance available to us as patients is essential. It really helps us to know that we're not alone. It helps us to know that there's an organization out there that's advocating for us, that's making sure that people get screened early, that making sure that there are people out there who are touching base with other survivors and using our experiences to make the next person's journey a little bit easier. It's also nice to know that CCA is working with government agencies to increase the funding for screening, for research, for development of new chemotherapies and new treatments, so that as those of us that are living longer with this disease have those options available to us, so that we can be here to do things like raise our kids or remain productive members of society.
It does a lot for what we do at the Colon Cancer Alliance on the prevention side. We also fund cutting-edge research.
Yes.
And then we also provide a number of extremely high-quality patient support services. So it helps on our 800 number, our website that we have, some of our national Dress in Blue Day, and a number of different programs we have that can be found at ccalliance.org.
It's a really wonderful place for people to go and share their experiences. And why it's so important to share your experiences is we recognize that many cancers are related to each other. And so, for example, if you have breast cancer, you have a 1.5 increased risk of having colon cancer. So even if you're 40 years of age and you have a breast cancer, you're more likely to have colon cancer. So you really need to be screened at the age of 40, not at the age of 50.
It was the best thing that I think I've ever done, because now they're like my second family. They've been through it, they're going through it. It's just comforting just to be around people who you can share your experience with.
For me, it's a way to all unite and to bring attention to a cause that doesn't, in my opinion, receive as much publicity as, say, breast cancer, because my aunt she is actually now 7-year survivor of breast cancer, and that cancer receives so much publicity and so much support, and I really felt like this is a way for all the families impacted by colon cancer to get involved and to come together.
Many, if not all, the teams are formed around a central person fighting the disease, or in memory of that person who lost her life to this disease. So what's special to me is to see that love, that passion, that energy dedicated and wrapping around a specific person in support or in memory of, on a single day in time when we're all in the same place for the same reason.
I met the most amazing people. It was the first time in my life that I didn't feel alone in my diagnosis. It was the first time I had ever met somebody else that had been diagnosed with colon cancer that was my age. And that was essential. That made me feel so strong and so capable, and it gave me strength to keep fighting.
One of the other sides we see that is unique is we get individual corporations will participate on the wellness side. Companies will come out and say, this is a great thing we want to support. Our employees should get screened. It's a great way to get them in front of screening. Maybe they're not as afraid to see about it when they see a bunch of people running around in their underwear and people being so open in, at the health fair and talking about the different types of screening methods, the different types of treatment if they were to have it, the different types of prep that are out there that a lot of people don't like to talk about it. But we find a way to get that all out in the open and really talk about it. So we're starting to see more and more of the corporations get involved because they want their employees to talk about and get screened.
All right, we're thrilled to be here. Stop Colon Cancer Now is a national initiative that tries to connect patients to local facilities and gastroenterologists in order to be screened. And we thoroughly support the Colon Cancer Alliance. This is our 3rd year attending the Undy 5000, and we think that it's critical to the prevention of this disease, which is in fact almost entirely preventable if patients would simply get screened.
And each person that participates is going to go out and talk to 2 or 3 or 4 people. So the bigger the team, the more the word gets out. The other thing is everybody comes to you when you've got something like this and they want so badly to help. And there's really nothing that people can do other than just love you and support you and remind you that they're there and give you prayers and love and caring concern. But that doesn't feel like much to people. They want to do something. And so this is a way for my friends and my family to do something. And I tell them it is in support of me and also hopefully will prevent this from happening to someone else.
Be amazed at how many of your patients, I go to the event and hundreds of my patients show up, and it's really rewarding because they come up to you and you realize they're living their lives and sharing with their families and enjoying life again.
So if you're a non-medical corporation, you could use this event actually as team building, wellness, camaraderie, competition.
Oh yeah.
All sorts of things.
Yeah, and we're seeing that more and more. Companies are taking advantage of that and saying this is a great event, it's fun, and it also saves lives. 1 in 20 people are personally touched with colon cancer, which is terrible. So normally there's even someone in their company that is, hate to say it, recently passed away or might be newly diagnosed or a survivor that they can all rally behind and show that, yeah, we need to get screened. So we're seeing more and more of that. And it's a great venue for that also.
Good morning. This is Rose Tanakungva from the Hopi tribe, and I'm the case manager for the colorectal cancer screening program. And these are part of our staff that work under the Hopi Cancer Support Services, and we're glad to be here. Go Undy 5000!
The Undy gives you the opportunity to know that there are other people going through exactly what you're going through, and there's a sense of camaraderie and a sense of survivorship and strength that goes along with those people. You're not going to get that in very many other places. That's what makes these events so special.
Hi, I'm Mario Medina. I'm with the University of Arizona Cancer Center, Dignity Health St. Joseph's here in Phoenix. Our mission for the Cancer Center is to prevent and cure cancer. We're here today to support the Colon Cancer Alliance and the Undy 5000 as part of our support for colon cancer prevention and awareness.
Join the Undy 5000, be a part of something that has affected so many lives, and others that are continuing to battle this disease that doesn't have enough awareness out there for others to learn from, just to gain the knowledge and the support and have fun with it. We can also have fun with it. But just with my personal experience, it's, why not learn and spread that awareness to save lives?
Boy, I can't believe another Undy 5000 here in Arizona is in the books. I mean, look at this place. The state capitol is not only alive with people, but it's alive with spirit. I think the Colon Cancer Alliance chapter here in Arizona has really, in the last 5 years, has laid the groundwork for an amazing race. I think people are really starting to get the message. And the best part about it is they're passing the message along. They're telling their friends, they're telling their families that this disease is beatable. This disease can be beat if you get early screened. We've got the State Department of Health behind us, making the word out all across the state. And I think the momentum is building right here in Arizona.